Good day. I'm Dr. Hashimia Babaran Palma, a gastroenterologist here in Capital Medical Center. In the Philippines, among the leading causes of death are related to the digestive tract. Colorectal cancer ranks fourth among the cancer-related deaths of Filipinos. According to the Philippine Cancer Society Incorporated, almost 75% of the individuals affected were aged 50 and above, while only about 3% were children 14 years old and below. Colorectal cancer, more commonly called colon cancer, is a disease in which cells in the colon or rectum grow out of control. The colon is the large intestine or large bowel, while the rectum is the passageway that connects the colon to the anus. Colorectal cancer starts as abnormal growths in the lining of the colon and rectum called polyps. These polyps grow slowly and may take approximately 10 years for it to develop into cancer. However, not all polyps progress to cancer. A change in bowel habits, such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days. Rectal bleeding. Blood in the stool which might make the stool look dark brown or black. Cramping or abdominal pain. Weakness and fatigue, or unintentional weight loss. These are overweight or obesity and not being physically active. Being overweight raises the risk of colon and rectal cancer in people, but the link seems to be stronger in men. Getting and staying at a healthy weight may help lower your risk. Certain types of diet. A diet that's high in red meats such as beef, pork, lamb, or liver, and processed meats like hot dogs and some luncheon meats raises your colorectal cancer risk. Cooking meats at very high temperatures like frying, broiling, or grilling creates chemicals that might raise your cancer risk. Smoking. People who have smoked tobacco for a long time are more likely to develop and die from colorectal cancer. Smoking is a well-known cause of lung cancer, but it's linked to a lot of other cancers too. Colorectal cancer has been linked to moderate to heavy alcohol use. Even light to moderate alcohol intake has been associated with some risk. It is best not to drink alcohol. If people do drink alcohol, they should have no more than 2 drinks a day for men and 1 drink for women. This could have many health benefits, including a lower risk of many kinds of cancer. Here are also some risk factors that are non-modifiable or cannot change. Old age, a personal history of inflammatory bowel disease, colorectal polyps or colorectal cancer, a family history of colorectal cancer or adenomatous polyps, Lynch syndrome or familial adenomatous polyposis or FAP, race and ethnic background, or having type 2 diabetes. A screening test is a proactive way to look for signs of cancer or other conditions. Through screening, the doctor may find polyps before they turn into cancer. And if found early enough, cancer is often easier to treat. Doctors develop a colorectal cancer screen plan based on personal risk factors and family history. Screening options for colorectal cancer include lab test. A sample of stool is examined for traces of blood. Flexible sigmoidoscopy. A tube that with a tiny camera on the end is inserted to the rectum to examine the rectum and lower part of the colon. Computed tomography or CT colonography, also known as a virtual colonoscopy, which takes images of the entire colon with combined power from X-rays and computers. Or colonoscopy. This is the gold standard for colorectal cancer screening as it can detect and remove precancerous polyps. This procedure involves a flexible fiber optic scope with a camera that is inserted through the rectum and is carefully advanced to visualize the colon under mild anesthesia. In several countries, colorectal cancer screening is recommended for people starting the age of 50. Screening at an earlier age, usually at 40, is advocated in first-degree relatives of patients with colorectal cancer and in those with other additional risk factors. Drink plenty of water. The digestive system needs to be well hydrated to function well. Without good hydration, you may suffer from constipation, dehydration, and host of unwanted symptoms. Adequate sanitation and proper hygiene. This prevention would include the proper handling of food and water, proper storage of food items, and clean environment. Mind food intake. A diet high in refined carbohydrates, saturated fat, and food additives has been linked to increased risks for developing digestive disorders. Fortunately, scientific evidence suggests that diets high in nutrients can protect you against digestive diseases. Get plenty of fiber. Based on the Philippine Dietary References Intake or PDRI, Filipino adults are recommended to consume 20 to 25 grams of fiber daily. A diet rich in fiber can help digestion and prevent constipation. Add healthy fats to your diet. Adequate fat intake improves the absorption of some fat-soluble nutrients. Omega-3 fatty acids found in flax seeds, chia seeds, nuts, especially walnuts, as well as fatty fish like salmon, mackerel, and sardines reduce inflammation, which may prevent inflammatory bowel disease. Chew your food. Digestion starts in your mouth. Chewing your food thoroughly ensures that you have plenty of saliva for digestion. This may help prevent symptoms such as indigestion and heartburn. See gastroenterologist regularly. One of the best things you can do to improve your digestive health is to visit a gastroenterologist on a regular basis. Oftentimes, it can be difficult to pinpoint something is wrong in your own. A gastroenterologist can assess if you have unusual symptoms and recommend lifestyle changes as well as medications that can help improve your health. Living a healthy lifestyle by avoiding smoking, consuming excessive alcohol, regular exercises, and eating the right food all can lower your risk of cancer in the colon and rectum. For more information, visit our website or Facebook page or call our care concierge to schedule your visit.